guys, it's your favorite fitness show right here on iBrandTV, Fit and Well, and of course with your favorite girl, Michelle Abanom. Now it's time to get that 10 minutes daily dose of fitness. It's important to stay fit and healthy always. Did I hear you say fitness time? That's right. We'll go on a short break, and when we return, we'll head straight into the focus for the day. Glad to have you back. If you're just joining us, this is Fit and Well on iBrandTV, and I am live at Kado Place with our guy, of course, Diallo. So Diallo, what you have for us today?
Today we're going to be doing CrossFit exercises, circuit workouts. Let's burn this fat. Can we get into it?
So all of these exercises are to burn fat.
Yeah, to burn fat. And apart from burning fat, these exercises help you in your day-to-day life. Like they include like functional movements that you do on a day-to-day basis. So let's get right into it. Let's kill it.
This one looks interesting.
Let's start. Very interesting.
Are you sure?
Very intense as well. Let me tell you.
Let's get right into it.
Are you ready?
Yeah,
let's
I am.
Okay, so guys, this is like Chelsea versus Arsenal. So
no, don't do that.
So let's see who's going to win. Let's see who is going to win. So this is a race, Michelle. I'm sorry, I'm not going to be nice to you here, okay? So we'll pick and drop it there, then we'll move on to the next program immediately, okay?
Okay.
Are you ready? Don't cheat. 3,
go
2,
easy, please.
1, and go. Let's go. Nice one, nice one. Keep going. Keep going, keep going. Let's go. Looks like Arsenal is winning. Let's go, let's go. Nice one. Last one. Last one. Last one. Nice one. So we continue immediately here. Okay? Go this way. Squats and down. Squats and down. Let's go, Michelle. Nice one. Then you go this way. Okay? So now let's go. Okay, so guys, we're going to be doing this 20 times. 20 reps. Are you ready? 20 reps, Michelle. Let's go. 3, 2, chest out, and sit. Let's go. 1, let's go, quicker. 2, let's go. 3, come on. 4, 5, 6, 7, 8, 9, 10. Now we're swinging it this way. We're swinging it up. 1, together, let's go. 2, go all the way down. Come on, push. 3, just 10. 4, all the way down. 5, come on. 6, let's go. 7, 8, make sure you're breathing in and out. 9, one more, Michelle, and 10. Come on, let's go. Next one, this way, in and out, in and out. Make sure you're moving your hands. Moving your hands, moving your hands. Let's go. Let's go. Michelle is going to represent Nigeria. She's our top striker. We go this way now. You're done. Come on, let's go this way. Come on, Michelle. Come on. Nice one. You have one more, just one more, very easy. Come on, this way, high knees, come on. Nice one. Let's finish up here. Come on. Here, come on. Push. Catch your breath. 3, 2, 1, come on, push. 3, let's go. 4, 5, come on. 6, 7, keep your waist low. 8, your waist low. 9, and 10. Now straight. Last one, we're finishing this way. Come on. 1, 2, look up. 3, it's not supposed to be easy. Come on. 6, one more. Come on. 7, 8, 9, and 10. We walk down there slowly. It's fine. So for this exercise, let's go down this way. Let me on your toes, please. On your toes. Then we slide. Let's go. Nice one, Michelle. You touch, you move. Let's go. Touch and move. Come on. Let's go. And you touch. So now we're here. Michelle, pick up. Let's go. Go down this way. Come on. This way. Chest out and down. Hands to the front. And we pull. Let's go. 1. Together. Faster now. 2. Let's go. Nice one. 3. And 4. And 5, bang, 6, bang, you're working on your back. 7, bang, let's go. 8, bang, 9, bang, and 10. Drop. Michelle, now we're here. Are you ready? We're going to go this way now, okay? We do 10 of this, and 10 on this side, twice, okay?
Okay, let me see that again.
The right hand up, and then elbow to your knee. Are you ready? 3, 2, 1, go, let's go. 1, let's go. 2, 3, 4, come on. 5, let's go. 6, let's go. 7, let's go. 8, let's go. 9, and 10. We switch to the other side immediately. Come on, it's HIT. 3, 2, 1, and go. Let's go. Left hand now, and so on. 1, tap. 2, tap. Come on, Michelle. 3, tap. 4, tap. 5, tap. 6, tap. 7, tap. 8, tap. 9, tap, and 10. Easy. So here, we're going to face the mirror now. This way. Are you ready? So we do this punching. Let's go. Make sure your hands are moving. Nice one. Let's go together. 1. Let's go. 2. Let's go. 3. Extend your hands fully. 4. 5. 6. Nice one. 7. We're going to 10. Just 10. 8. 9. And 10. Here you go. Don't worry, I'll bring it to you. Here you go. So here we're working on our sides, okay?
Okay.
On your obliques. Catch your breath for 5 seconds. 5, 4, deep breath, 2, 1, and pick up. With your right hand, left hand on your head, and then we go down this way. 1, come on. 2, to the side. 3, don't bend your knees. 4, come on, Michelle. 5, 6, 7, 8, just 10, come on. 9, and 10, we switch to the other side. 10, come on, let's be strong. I'll wait for you. We're going back the same way. Come on, Michelle. Come on. We're almost done. Nice one. Last one. Last one. Be strong. Let's go. We're going to the side. Easy. Easy steps. Come on. Easy steps. High knees. High knees. High knees.
Okay.
Nice one. We go back there and we're done with this. Okay, come on. Come on. Let's go. Finish up. Finish up. Let's go back there. Easy steps on your toes. No, you're not going out. You're still inside.
Okay.
Yeah. Nice one. Smile and smile. Always smile at the end.
That's all.
So let's go. This is the last program. Are you ready? It's very easy. Okay? Let's go. So guys, you can do this on your staircase. Up and down. Make sure you're on your toes. Okay? 5, 6. Nice one, Michelle. 7, 8, 9,
10.
and 10. Muchos gracias. When you're done, guys, you need to stretch. Always stretch after working out to avoid cramps on your leg, okay? So this way. Up. 3, 2, 1. To the front. The right hand this way. Push. 3, 2, and 1. This is 3, 2, and 1. Now last one. Down. 3, 2, and 1. Muchos gracias. Thank you so much.
Thank you. It's been a great time on the show. We've learned a lot, and I feel like I've lost about 50 kg already. Summer body loading. Now we are wrapping up right here on this segment. It's over to you, Perpetua, on the wellness segment.
Hypertension. Hypertension is a major risk factor for cardiovascular diseases, and prevalence rates are critical to understanding the burden and envisaging health service requirement and resource allocation. The number of Nigerians living with high blood pressure is estimated at about 56 million, even as the World Health Organization (WHO) calls for intensified effort to prevent and control hypertension. According to the World Health Organization (WHO), globally, more than 1 billion people are known to have hypertension, and the figure is estimated to increase to 1.5 billion by 2025. In Nigeria, the prevalence of hypertension is at 32.8%, while meta-analytical study published recently estimated the countrywide prevalence to be between 12.4 and 34.8%. The disturbing reality of these statistics is that between a staggering 20.08 million and 56.37 million Nigerian citizens are hypertensive. The prevalence of hypertension is also increasing globally. In 2000, 972 million people had hypertension with a prevalence rate of 26.4%. These are projected to increase to 1.54 billion affected individuals and a prevalence rate of 29.2% in 2025. Incidence rates of hypertension range from 3 to 18% depending on the age, gender, ethnicity, and body size of the population studied. In Nigeria, more than 7.5 million deaths are attributed to the condition, about 12.8% of all deaths. These account for 57 million disability-adjusted life years, which accounted for about 3.7%.
Hypertension is a leading cause of morbidity and mortality in Africa, and Nigeria, the most populous country in the continent, hugely contributes to this burden. Welcome and thanks for joining us in this segment. I am Perpetua Fasami Peter. We're joined by Dr. Odia Enaholo, a family physician. Welcome, Doctor.
Thank you. Thank you for having me, Perpetual. Thank you for having me once more.
What's hypertension?
Yes, hypertension is elevated, another term or a medical term for elevated blood pressure. Every human being has a blood pressure, and we have a normal blood pressure. But when this pressure goes above the normal, it leads to a disorder that we refer to as hypertension. Just means that the pressure in the blood system or in the vessels carrying the blood is so much that it causes other problems in the body. So elevated blood pressure or blood pressure above the normal is what is referred to as hypertension.
That's noted. Could you please help us understand the reading or the numbers? Yeah.
Okay. So for the purpose of this program today, and since we are speaking to a lot of people who are not, who are lay, I will use the value 130/80 as the benchmark. So any patient who has a blood pressure of 130/80 and above will be regarded as having a high blood pressure. When we measure blood pressure, there's a way it's measured. We have a systolic value, which is the value of the number I mentioned first. Then we have a diastolic value. Systolic and diastolic simply means the term we refer to when the heart opens up and when the heart closes. When the heart contracts or closes, because the heart is actually a pump, it's in diastole. And when it opens up to refill, it's in systole. So systolic pressure is usually higher than a diastolic pressure. So a normal blood pressure, elevated blood pressure or hypertension will be a pressure that is above 130/80 millimeters of mercury. Anything above that is regarded as hypertension.
Doctor, there is that which is called the borderline. What is it?
Okay, so for borderline hypertension now, let's say I have given a benchmark of 130/80. So you could have someone in the neighborhood of he's 129, he's 130, he's 131. It doesn't just go beyond that range. Then for the diastole, you see him as 85, 82, 83 is borderline. So that is what we refer to as borderline hypertension. It still calls for a lot of intervention that we do for people who are hypertensive, but generally it just tells us it's early onset. It's early onset.
Hypertension is also referred to as a silent killer. How is it so?
Yes, it's important for us to understand why it is referred to as a silent killer. For a lot of disorders or a lot of diseases, we have symptoms that they present with. Someone who has malaria, for instance, would have a fever, would have a headache, might be vomiting, will have generalized body pains. Someone who is diabetic can have frequent urination, can have frequent intake of taking water. So there are symptoms most diseases present with. But for hypertension, it comes very, very silent. You have no symptom. Some people just tell you, oh, they are fine. And they do not know they are hypertensive until their blood pressure is measured. For some others, they just come with headache. But you know, when you are stressed, when you are hungry, when you are tired, you could have this headache. So a lot of people relate this headache they have to maybe being stressed from work or being tired or something else. And they continue to take maybe painkillers for that. But for a lot of people, it comes with no symptom until it strikes them, either in the case of them coming down with a stroke or in the case of them coming down with any form of hypertensive emergency or urgency. So that is why we refer to hypertension as a silent killer. No symptoms usually present.
Saying that hypertension presents no symptoms, how can we stop it in its tracks? I mean, there are no symptoms, so what do we do?
Yes. So a good way to know you are hypertensive, the only sure way to know you are hypertensive is to have your blood pressure measured. And that is why we preach medical checks, routine medical checks. In this part of our world, people only go to the hospital when they are down, when they are sick. We do not attend well clinics. There is a concept of wellness clinic or a well clinic. You don't necessarily have to be sick. You don't necessarily have to be having a fever of 38 degrees Celsius or vomiting before you should go to the hospital, especially for adults who are approaching their 40s. So once you hit 40, you hit the 40 mark, I usually tell them it is important at least once every year, go and see your doctor, have your vitals checked. And a major component of having your vitals checked is your blood pressure. And when your blood pressure is checked, to be determined whether you are hypertensive or not. So that is one way of knowing, just to check your blood pressure. And that can be done when you have the routine of checking yourself or routine of knowing that something is just off about how you feel. And you just, oh, I just want my blood pressure checked, especially when you are age 40. That is not to say we do not have hypertension in the young. We have people who are in their 20s, we have people who are teens, especially when it is secondary hypertension, something else causing the hypertension. They could have hypertension as well. But largely, we see hypertension as one gets older.
All right, doctor, you talked about primary hypertension, and that means there is secondary hypertension. Can you help us understand these concepts?
Yes. So primary hypertension is the commonest form of hypertension we have. It's It's referred to as primary hypertension or essential hypertension. There's nothing inducing it in the body. It's just as a result of stressful lifestyle, as a result of being overweight, as a result of having excessive cholesterol or lipids in our system. Habits like smoking or alcohol use will all predispose you to having that kind of hypertension. As against secondary hypertension. In secondary hypertension, there is a primary disorder. I'll give you an example. Someone who has a kidney disease, for instance. Because there's a kidney disorder, it leads to that patient having hypertension. So that kind of hypertension is referred to as secondary hypertension. So those are the distinct ways of differentiating the two classes of hypertension, primary and secondary hypertension.
I remember you mentioned headache as a likely symptom of hypertension. I also talked about the risk factors of primary hypertension. For now, though we know it is a silent killer, however, are there telltale signs or likely symptoms of hypertension that we need to know?
So what I'll tell our viewers is this. If you've been having recurrent headaches, especially you take paracetamol or you take any kind of pain relief, and you find that, oh, this headache is still there, or you just feel this kind of wooziness around your head, or let me refer to it as unwellness around your head. You just tell yourself you feel funny. It's most likely your blood pressure is up. So headache that is not amenable to common painkillers, it's one of the symptoms. Dizziness, you just feel dizzy or you feel lightheaded, it's one of the symptoms of hypertension. Those are the commonest things that would make a patient present to the hospital to say, oh, I think something is off about me. And when we have the blood pressure checked, it is found that this patient's blood pressure is elevated. Okay,
very quickly, let us talk about the risk factors of hypertension.
Okay, yeah, so risk factors for hypertension, like most non-communicable diseases, has to do with lifestyle. So excessive weight, obesity, it's one risk factor. That leads us to the next one. Not having exercises or sedentary lifestyle. You go to work, all you do is sit all day and you don't exercise. It will still lead to hypertension. Poor dietary habits. Taking a lot of sodas, taking a lot of fried foods, taking a lot of fast, over-processed foods. These diets are not healthy. They're not rich in things that would prevent us from having hypertension. That again will lead us to have hypertension. Smoking, it's a major, it's a big one for hypertension. Reduction or cessation of smoking alone cuts the risk from hypertension or hypertension-related complications by a very, very huge percentage. Use or overindulgence of alcohol, it's another risk factor. So you find out that most non-communicable diseases, diabetes, hyperlipidemia, hypertension, like we are discussing now, all have the same risk factors that will promote this disease. So these are some of the risk factors relating to hypertension.
Earlier in the conversation, you mentioned stroke as a complication. Now, what are other complications people living with hypertension are predisposed to?
Yeah, so hypertension has a lot of complications. The commonest is the stroke, which we all know about. The stroke is an event, that occurs in the brain. So depending on the parts it occurs in the brain, it will impact on that portion of the brain that it controls. If, for instance, it affected the right side of the body, it affected the left side of the brain, it will paralyze the right side of the body. if it affects the part that controls vision or speech, it will impact on those parts as well. Hypertensive retinopathy, which will in turn lead to blindness, is another complication from hypertension. Hypertensive encephalopathy, which is a disorder of the brain, but this time what we have is the patient is behaving irrationally, the patient is behaving confused and not aware of his environment. Erectile dysfunction, these are some of the complications that can be attributed to hypertension.
How can we prevent hypertension?
Yes, it's a very simple way at that. Healthy lifestyle. I talked about some of our risk factors earlier. A reversal of all these risk factors will not put you in harm's way. So having the ideal weight, your BMI should be within the normal range, 19 to 25. That alone cuts down the risk for hypertension for you. Eating right, having the right diet on your plate. There's a dietary approach to hypertension that is usually recommended for patients who are hypertensive. We refer to it as DASH diet. DASH is actually an acronym for dietary approach to stop hypertension. It's basically diets with low sodium and high potassium, with a lot of vegetables, a lot of fruits. And where we have potassium, it's most of our fruits, especially bananas. So patients who are hypertensive, we urge them to cut down sodium. And the commonest place we find sodium is in our condiments, like salt or other condiments we use for cooking. So that is one way. Cessation of smoking, it's another way of cutting down the risk or reversing or preventing you from having hypertension. Exercise, it's important, I must emphasize this. Exercise as well, because exercise will help in your weight reduction. Exercise will affect or impact on your overall well-being, and that will help in cutting down the risk of you developing hypertension, especially when you have a genetic disposition to having or developing hypertension. Then, of course, reduction in alcohol. These are some of the ways we can reduce or cut down the risk for developing hypertension or preventing hypertension.
It feels like every answer leads to another. Everything seems intertwined to a very large extent.
Exactly. Antihypertensives are medication we give to drop the blood pressure. There are different classes of them that have different mechanisms of operation, but they come in different forms. They can be given orally, they can be given parenterally. Parenterally means other routes outside the oral routes. So intramuscular injections, intravenous injections, or other routes that are known to medical practitioners. But antihypertensives are the mainstay. In addition to that, we will cancel on all the reduction of the risk factors. So if you're overweight, for instance, part of your treatment modality will include weight reduction for you. That would include exercise, reduction in your calorie. Overall, it will impact on you having lower blood pressure. We'll still recommend other modalities like cutting down stress. If you lead a stressful lifestyle, reduce stress as much as possible.
Thank you so much, Dr. Odia. That was very informative.
Thank you. Thank you very much. Thank you very much.
I hope that was as informative for you as it was for me. Thank you for joining us. I am Perpetua Fasan Repeater. Back to you, Michelle.
Great job, Pep. I really learned a lot from that. We've come to the end of this beautiful episode of Fit and Well on iBrandTV. Till I come your way next time, I am Michelle Abanom. Bye for now.